I'm here to announce the Service Awards, Service Award for 2016. So the word service can mean a lot of things to a lot of people. Obviously, tonight's award is about serving others in addition to serving your own community. And what's kind of nice about this award, and like Andy said, we got a lot more nominations this year than we did last year. So the finalists, I guess, feel even more honored. And I would anticipate this growing each year. But this year's nominees range from statewide systems to regional systems. They're using products such as our licensure, report writer, service bridge, elite, integrations. They're focusing on areas such as volunteer applications, renewal certifications, STEMI systems, stroke systems, CARES was mentioned, NEMSIS 3. So it's a really nice, broad range of topics. I don't envy the judges in this category, that's for sure. So let's roll the video.
Greg Postlethwaite, Virginia Beach Department of EMS.
Virginia Beach EMS is the nation's largest volunteer EMS agency with more than 300 applicants per year and 1,200 active volunteers. The agency is transforming its implementation of ImageTrend license management from a license tracking platform to a fully featured personnel records management system, allowing these applicants to enter their information online via a public portal. This, combined with workflow automation, significantly reduces the time each full-time employee spends on entering data and tracking each application. It also provides visibility to senior leadership of the process through the applicant progress dashboard.
Adriana Early, Colorado Department of Health.
Implementing Colorado's online application tracking hub, or OATH system, required a redesign of Colorado's certification process for approximately 120 educational programs throughout the state and the transfer of 60,000 legacy records. The project was completed on time and with no interruptions to the certification process, thanks to Colorado's implementation team of one, Adriana Early, and help from the ImageTrend team. With OATH, the department has the tools necessary for the 2016 recertification cycle and to back up its promise of providing the highest quality of pre-hospital care for Coloradans.
Don Rice, State of Nebraska.
Using ImageTrend's reporting and statewide STEMI system, the state of Nebraska studied cardiac arrest incidents and mapped them out within the state. After presenting the information and the potential impact automated chest compression devices could have in rural areas, the state was awarded with a $6 million grant to deploy these devices to rural services with limited resources. The result is a lower mortality rate, faster recoveries, and fewer cases of heart damage or neurological defect. Using data from ImageTrend's system, the department has saved countless lives and has been able to apply for grants to help rescue services.
Paul Beeman, Spalding Regional Hospital.
As the EMS Director for Spalding Regional Hospital EMS, Paul Beeman has worked to improve cardiac and stroke care in the state by configuring various documentation fields in ImageTrend's records system. He has focused on process improvement by creating and using key exports, including reports used to assist hospitals in identifying patients at risk for sepsis. Spalding Regional Hospital and Beeman were also instrumental in the pilot program of ImageTrend Hospital Hub that resulted in the Georgia Trauma Commission's funding for the solution.
Patrick Sennett, Advocate Good Samaritan EMS System.
The Good Samaritan EMS system and Illinois EMS Region 9 Steering Committee's goal is to manage its large amount of data while improving the UI, data entry workflow, and experience for users. Their work will ultimately benefit the 86 agencies that are part of the EMS system and the population of nearly 1.4 million it serves. Under the leadership of Committee Chair Patrick Sennett, working groups have moved the Illinois NEMSIS 3 project forward. Through its rigorous testing, the committee has recommended enhancements within ImageTrend Elite, including its power tools, and addition and modification of data elements and variables.
And the winner is Don Rice, State of Nebraska.
Thank you. It is an honor to be counted as a hooligan. For those of us that have been involved for so many years in the EMS industry, we know that many times the solutions that we try to come to don't come easy to us. We have to sometimes scrap and fight and barter and do whatever we can to get the resources that we need to do what's really in our hearts and what we want to do, and that's to save lives. One of the reasons why I'm truly blessed to be here is because it's fun to see people come from all over the country and share ideas across each other as clients working with a great vendor like ImageTrend. In fact, one of the photos that was up there, I don't know if the Alaska crew and team that's here recognizes that group, but that's Sitka Search and Rescue. Back in the days when I was going up there and helping you guys with Tim Bundy getting the Aurora project started. Anyway, so it's a privilege to be a hooligan because we all know what it's like to have to really work hard to come up with creative ways of working with systems to come up with ways of saving lives. What we did in Nebraska was the reports that we generated were nothing that were incredibly elite or complicated, but it's what it took for us to show people and break through some of the political barriers that we were fighting at the time, that we really needed to come up with a statewide STEMI system to save lives. So I want to encourage all of you to keep pressing on in the areas that you have to be creative and barter and do a little bit of negotiating to get what you need to do to continue saving lives. Thank you.